Okay, I think we'll go ahead and get started again. This is John Samet, and I want to welcome you all to this very important town hall. Um, just a few sort of housekeeping announcements. I'm sorry that we're not together. Any discussion works better when we're all in person, and I'm pleased, however, that we are able to get together via Zoom and have this discussion. Just so you know, we are recording the town hall, and it will be posted. Also, I'm hoping for your input during the session, and to do that, if you'll put your comments, questions into the Q&A, I will bring them up. Kayla Gray and Cindy Perry are with me to help synthesize the comments that come in. We're already at about 150 participants, and I'm just afraid with that number, we can't have everyone able to converse, but we'll find other ways and other venues so that we can be in smaller gatherings and have discussions. I think just to begin, why are we together now? I think everyone knows what has brought us together, the continuing issues of enhancing the equity, diversity, and inclusion of our school. It's been part of our mission, which I will show you as a reminder. But of course, there's a new urgency that's been added by the murder of George Floyd and its aftermath, and the imperative to address structural racism in all elements of our society, including our community. As a school of public health, we're concerned that with all that drives health and well-being, we need to take on structural racism as it affects our school and the population at large. I consider this town hall as a starting point in a new course for the school. The plan that has been distributed as a draft outlines how we will set this course. Today's conversation may have difficult moments. We're not collectively fluent in talking about structural racism, skin color, gender identity, and more. We may not have a common language among us. Be tolerant. The origins of this plan lie with our strategic plan. I'll remind you that we spent about a year working on the strategic plan, finalizing it in the fall of 2019. We then moved on to discuss how to implement the plan, and that work was going well and coming to a closure as the COVID-19 pandemic struck Colorado and changed our lives and the way we do business as a school. But that strategic plan and the work done around implementation, largely by our Inclusive Excellence Working Group, remains relevant. That was distributed along with what I called the draft plan in advance of the meeting. Today, I want to start with a quick review of the main 9 points in the draft plan that has been available, and move on to then to your comments. And let me pull that up. I'm going to share screen here. And okay, so what I'm going to do is just review the main points to set the stage for a discussion. And again, as we move through this, please put your comments, thoughts, questions. I may pose questions back to all of you to try and have some interchange in this format. So as a reminder, and this goes back to our strategic plan and what our school is about, our mission, our vision, our commitment to diversity and equity. And that's been ingrained in the school since its start. And all of us in public health are engaged with diversity, equity, racism, and the consequences for public health. We strive to build and maintain an inclusive culture internally, one that reaches across all that we do within the school and all the groups within the school. Again, this is back to the strategic plan for a moment. I think you can see at the top, to foster a culture of diversity, equity, and inclusion in everything that we do, and develop a public health workforce that can go out and make a difference. And clearly that involves addressing the full spectrum of social determinants of health and being ready to do so. Now, what I'm going to do is take you through the main 9 points that are in the draft plan. They are complementary to, and in some cases, overlapping with the strategic plan. So first, an internal assessment. It's called racial and ethnic equity assessment. This is taking a look internally, looking at what our structures are, how decisions are made, and what are the relevant realms of decision-making as we seek to become better at what we do in relationship to racial and ethnic equity, to address structural racism. What are our relevant policies? And those are our internal policies that we'll be focusing on initially, reviewing those policies, identifying them, looking at where race and ethnicity and who we are figure into hiring, promotions, leadership, and funding, and our practices and norms. And again, I regard this as a holistic assessment, looking at all the communities within our broad School of Public Health community, and our values. Are our core values aligned with our commitment to equity across all groups? That's point one. That's second, and again, this stretches back to the strategic plan, a broader look at inclusive excellence, and particularly giving emphasis to the emergent and urgent issue of racial equity, and again, acknowledging our diversity, which we do, but we can always do more and do better. And this assessment should help us in doing better in our efforts in regard to equity across the school. Educating ourselves. And here I think there are many things that we can do. In my weekly columns, I've talked about my own efforts to learn more and understand what I've been reading, some of the things I've been thinking about. I think this education needs to come more to the top of our internal agenda, and we need proactive ways to do this. And yes, there are trainings available. They are an important starting point, but this has to be a continuous process, one that we understand if it's working, and make changes as we move forward. So here mention training all faculty members about creating inclusive classrooms, facilitating discussions, implicit bias training, advancing our campus discussion about racial justice by inviting speakers who will give us perspective. I will say, as I've read and reminded myself of the history of racism in the country, as you go back and read about how things unfolded before and after the Civil War, and of across the 20th century into this one, it is amazing to me, and it has been a critical reminder and wake-up call how structures have sought to preserve racism. And this term of anti-racism is a very useful one, because certainly we are a school that will be and is anti-racist. More training opportunities around cultural competency, facility and communication, and keeping activities related to social determinants prominent within what we do as a school. This, I think, is an important step for us as a school in implementation to appoint an associate dean for diversity, equity, and inclusion. This is a position that I've discussed with leadership for quite a while. It's a position that I wish we already had in place, but we're moving quickly with a search for an individual who will serve in this role for the school, Associate Dean for Diversity, Equity, and Inclusion. The announcement has been posted, search committee formed, and for those of you who might consider yourself as interested in this position, it is posted and available. I intend to support this position with resources that will assure that this associate dean can help to make things happen and provide institutional leadership. The area 4 of our strategic plan specifically addresses diversity, equity, and inclusion, and we had moved forward, as I've mentioned, to implementation. We're in challenging circumstances, as I think all know, both because we are not in our offices and because we face fiscal challenges that are a result of the COVID-19 pandemic and its impact on funding. That said, there are many pieces of the strategic plan that we can move forward, that we will search for resources to make them happen. And we've been very careful to assure that we have resources to hire and support the new associate dean. This curriculum mapping assessment was called for in the strategic plan. And again, in terms of things that we can do internally, we can look at our curriculum in relationship to its content related to social determinants of health, health equity, social justice, including structural racism. And already some of the departments have been turning to looking at their curriculum. We need to do this systematically. This is important, and I think will be very useful also as we come to reaccreditation in 2023. Already, social determinants are a critical part of what needs to be in our NPH, DRPH curriculum, but here's an opportunity, I think, to, again, do better. I'm sure that we can. Partnerships, looking to institutions of higher education that have diverse student bodies. Some of that kind of exploration has gone on over the last year with conversations with MSU, Adams State, at UNC. Our program there has reached, tried to broaden its reach to the very diverse undergraduates at that campus. So we have been making efforts in that regard. We've had a scholarship program to bring students from the UC Denver campus to the School of Public Health for research opportunities. So we have taken some steps. Again, always opportunity to do more. And of course, at this moment, many people are interested in public health. We have an upsurge in the number of students entering this year. Over last year. Perhaps there is a COVID-19 effect, but I hope many of those students who are coming in who have perhaps been hooked by the public health crisis we're enduring will come from the communities who are bearing the brunt of the epidemic. And I think, again, we all know that this pandemic has driven inequities of health burden onto communities of color and those in lower income service jobs, as well as those in more crowded housing. The critical to me moving forward is more communications. I've learned being dean that there's never enough, and we'll look for some regular ways. Again, as I said, this is the first town hall on the topic of structural racism, equity, and inclusive excellence. We'll have more. I think we'll work through the ways that we can have those such that there can be real conversation, unlike today's kickoff town hall. I'm pleased that the students have made their voices heard. The students that we've heard from want us as a school to do things, and certainly I join them in wanting our school to do important things that will make a difference internally and also externally. We're living through an extraordinarily challenging moment, as all know, between the impact of the epidemic, the very disturbing happenings around racism, and frankly, things happening at the national level with our politicians. So this is a time and a moment where everyone is primed for action, and I don't want to lose that energy, and I want us to achieve some momentum and sustain it, and communication will be central to doing that. Much of what I've been talking about and presenting up to now has been about our internal environment as a school, our 3 campuses, our faculty, staff, and students. I think the question, the challenge of how we have influence externally is something that we need to think through carefully. Here I talk about points for leverage and action in combating and reducing structural racism and the social determinants of health more generally. We all want to do that. I've been frustrated, as have many. We have decades of research showing that racism affects health, that the social determinants of health are critical, and their impact starts before birth and extends across the life course. How do we make a difference? And I think that is important. And I think we're going to have to think about those points for making a difference. I mean, some are inherent. The research that we do, the data we present, the presentations made to different groups or in the legislature by our faculty, staff, and students, the personal efforts of many of you to reach to decision makers. But at a higher level, what is it that we do as a school? We have an advisory board that has been very helpful to me. The constituency of the advisory board, I think, should be broadened. The advisory board itself wants us to do that, to bring in more representatives of our the broad communities that are in our neighborhoods and in our state. So I think that is the last sort of slide to review the plan. There are 173 participants on right now. I'm delighted that you are here. What I'm going to do is turn to the questions that have come here, and we'll start with these. And please, as I speak, I'm sorry that I regret being the only voice on this, but make your voices heard through the Q&A, please. And so let me just start. So there's so here's let me just there's a first question, and that is about the resources to do the work that needs to be done around the assessment. So, I mean, in answer to that, I mean, I'm committed to finding and making available the resources that we need to do. I think if you look at what has been outlined, whether it's the assessment of us or looking at the doing the curriculum mapping, these are big jobs, and we will need to identify the resources to do them. I think a parallel question that is here is who will do the assessment, and how will the group be selected? So I think right now these are important process questions and things that we're going to have to work out. I see that the school's leadership and perhaps with the new AD as the lead will work on setting up the mechanisms to carry out these assessments and curriculum mapping. I think, again, your comments here would be helpful on how we set up an overall guidance structure in the school. Do we have a steering committee? For example, do we go through multiple town halls to communicate? I think we will work that through. With the strategic plan, I think you all know we had working groups with leaders, and that mechanism proved very effective, and it's a mechanism that I've used elsewhere. So I think we will set up this structure. We're certainly not at the point, but I appreciate that the recognition that there's a lot of work here to be done, and we'll have to support it. A comment here that one-time implicit bias training is shown to be ineffective. How will training be ongoing? Yes, you're right. I mean, I think that I don't see this as a sort of one-time, check the box kind of approach that we're going to take, that all faculty, for example, have gone through implicit bias training. I mean, I think we're talking about here an ongoing process, a commitment to evolution and change. So let's see, further questions about faculty recruitment. So let me touch on this issue. And I'm as distressed as, and have long been distressed about, in fact, the lack of diversity in public health school faculty. Faculty do tend to be mostly white, and the representation of persons of color is limited. And I've been in conversations for decades. I've been involved in pipeline programs, and clearly our efforts have not succeeded in making a transformation. I'm certainly very committed to enhancing the diversity of our faculty and providing support from resources from the dean's office or looking for them. We have, just as one example, 2 Native American faculty joining this year, intensely recruited, and the recruitment supported in part by the dean's office. So there's a personal commitment, but we need to find the candidates. And our searches. We've had a number of searches since I've been here. I recognize have not brought a diverse pool, and frustratingly, the communities that are bearing, whether it's the disease burden from the COVID-19 epidemic or chronic diseases or other problems reflecting the social determinants of health, are not well represented among our faculty. We need to do a better job, but we need to find another approach. Let me just go through things. So just a comment. So the new associate dean position is a question about the level of effort. So we're starting at 20%. We're going to learn what else is needed and hope that we'll see what is needed. I understand and recognize that the individual in this position could probably put 200% effort into this, but we will continue to. We want to get started. We want to get started in a time of fiscal challenge, and we are committed to having the resources to support the associate dean and to assure that there is a team that the associate dean can turn to. There's another comment here about the challenges, the equity impacts of choices made in response to COVID-19 related budget cuts. And let's see, that just disappeared. As budgets shrink, how do we do our best not to further widen inequities internally and externally? And I think this question seems to be one that relates both to the school and beyond across our campuses. So, just a couple of comments without going into sort of the broad fiscal picture. For this fiscal year we just entered, FY21, we're on reasonably secure financial footing. And that's in part because the University of Colorado has received CARES Act funding, and some of that will reach us, backfilling budget holes left in our state allocation. I think that in terms of future years and how cuts may need to be made, certainly our efforts directed at structural racism, inequities, inclusive excellence will remain a high priority. I can't predict FY22, the one that will be starting a year from now. So let's see what happens. But for now, we are certainly committed. I'm committed as dean to support the new dean, the new associate dean, and the activities. Let's see. So here's a question that bring up. I'll read it. How is the School of Public Health planning to address the ways in which the public health field has perpetuated racism? In research, for example, it's not uncommon to see public health researchers refer to differences, quote, caused by race. I mean, I think this is it's a great question. I think this fits with the curriculum mapping, but I think it's a question that has to infiltrate the formulations of research and research questions. And I think, again, sort of paraphrasing and caricaturing much of our research, you'll see things like, we used a multivariate model and adjusted for the following factors. And into that list will appear race and ethnicity all too often. And I think that there's a new sensitization that hopefully will be sustained about how researchers have approached concepts of racism, concepts of race, ethnicity, and identity in research. I think a lot of it has been unthinking and mechanical and far too simplistic. And I know conversations with Jill Norris, for example, our chair of epidemiology, she is already thinking along these lines, but this is a shortfall, an oversimplification that needs to really reach across the field to researchers, funders, journals, and so on. You know, the questions raised about an additional core course for our students on power, privilege, and oppression. So I see this as part of the curriculum mapping. We have a course that is within the Department of Health Systems Management and Policy on health equity, but I think as part of this curriculum mapping, we need to look at not only the content in that course, but elsewhere, and make certain that we have the coverage that is needed. Let's see, I'm just going to read a few relevant comments. Here's a comment that our program, the Rocky Mountain Prevention Research Center, has created a committee to talk about this and work on ways. And I think, again, this just is a reminder that the conversation, the work that we're doing, the plan, similar efforts have been launched by units within the school, departments, and others. Let me sort of continue down. Let me see, okay. So comment about discussing faculty, I think, and training for staff. I think if you look closely, you will see that, that faculty, staff, and students are mentioned throughout the planning and training efforts. And again, comment, there are many efforts and plans to enhance diversity, inclusion, and excellence right now in the AMC campus. I'll point out that we have a new vice chancellor, associate vice chancellor, that has just been filled for our campus in a campus-wide committee. And this comment goes on to comment that there are many different efforts going on by professional societies and others, ending in how do we develop our externally facing agenda in a way that leverages these efforts and is not duplicative. And I think our externally facing efforts are going to take a lot of planning. I think we're going to need to look at our connections. I think we're going to need guidance. One of the commenters asked about engagement of communities and community groups, and I think that will be critical. And I mentioned our advisory board, and I think that we can broaden that, but I understand that we can have better relationships, better networks with our communities around us. I have to say that I think there's a variety of different community efforts in place. We do community-based research. We do a lot of public health practice. we are perhaps not systematic enough as a school in establishing our community networks. Um, I think we'll need to think about how we do a better job and look for models. I think unfortunately, I think our failings are shared by many schools of public health, and I think it's part because public health is, in some sense, the faculty and what we do in schools of public health has become, quote, more academic. I think our school is actually notably strong in our practice, but we can do more. Let's see. A reminder, strategic plan and student life section specifically. So we spent a lot of time thinking about student life and the campus, and of course, in the strategic planning effort, that's been turned upside down. And sorry, there's some noise here, but the question asks about how will we engage students of color away from their social support since classes are remote in the fall. We've spent time thinking about how a school that is not open physically but virtually remains a school. And all our departments and other units have been putting thought into this. I think you've given myself and others something to think about here in terms of how we do engage different populations, whether students of color or other groups, and create networks. And I think we'll put this on the action agenda for the fall. We've been putting a lot of thought into trying to be more than a set of online courses as we come into the fall ahead. It's going to be challenging because students will not have had the opportunity to have met one another as they did in the academic year that just ended. So I thank you for the comment. And let me see, I'm just give me a moment here to scan through. Let's see. Let me just scan a bit. So in terms of getting involved, which seems to be something, we'll have mechanisms to do that soon enough. There's an attendee who I have to talk with who's sitting with her 13-year-old niece. She wonders what the school can do to increase the pipeline of future students into undergraduate and graduate programs in public health. How about students coming out of under-resourced schools who may not do well in standardized tests? So this is a question I have to respond to, and I hope the 13-year-old who's listening in who's planning on going into public health. There's been probably no time like this one when 13-year-olds knew about public health. I'll just say a bit of comment about pipeline programs because I've lived through many different efforts to create them. When I was at Johns Hopkins, our students came up with a great idea. Just as an example, they created a program on epidemiology for high school students that was based on efforts to create problems around the challenges faced by Baltimore high school students. They went into the public high schools of Baltimore with their courses, collaborated with their problems, and collaborated with the science teachers, and it went well. Whether there was a long-range impact, I don't know, but clearly we need to think about what potential partnerships are that reach back to high school and middle school. I've actually seen the COVID-19 pandemic as one opportunity, for example, creating teaching modules that could be brought into the public schools that would provide an introduction to public health to students. I think there are other opportunities trying to link our students back more, or college students back more, into partnering with local public health agencies that are engaged with populations of color, populations bearing the brunt of the COVID-19 pandemic. I think one thing we've come out of the pandemic so far is with very strong ties, working relationships with local public health that I think are an opportunity to build and expand. And I will say I've been involved in some very high ticket pipeline building programs that really didn't work. So I think some of our opportunities lie in partnering. Over the years have been some efforts on the part of the school to reach out, and I think we need to go back and revisit some of those discussions. So I hope we have a 13-year-old coming into public health. I was a good deal older when I discovered it personally. And again, I'm seeing a lot of you who want to be involved and work on all that lies ahead. And send me emails, send me your thoughts, and we'll begin to develop a pool of those who want to engage. And let me know what you want to work on. Let's see. Let me just keep going here. So here's a comment that I'll read to you, and the word excellence is often tied with concepts of meritocracy, which is a racist construct that makes academia continuously widen the gap in society, mostly unintentionally. How do you propose to navigate such issues as meritocracy and excellence that permeate our academic cultures? So I think this comes out of, relates to the proposed assessment where we started, where we talked about what is embedded within our structures, the way we act now, speaking particularly to faculty, around issues of promotion and advancement. And I concur that there's some embedded, it's racism, it's origins. I mean, a good example, we abandoned the GREs this year for admission to the MPH program, one of the early schools to do that. And it is clear as we've learned more about standardized testing that those tests are so influenced by not what do you know or what your capabilities are, but by who you are and whether you've had tutors and extensive test preparation and so on. So I think this is a great example of the kind of issue that needs discussion as we do the assessment. A lot of, and again, this steps back to who we are. We're part of 3 universities, each with their own structures, policies, and procedures that build on ideas. I'll use the commenter's terms of meritocracy, of, quote, meriting advancement, and what are the values given within these systems. I think having come from institutions that really gave emphasis to meritocracy and sort of viewed themselves as elite, those structures were really pretty clearly visible. And a lot of the work that we do in communities, working with local populations, would not have received evaluation in those settings that we we give them here. Let's see, I'm still scanning through. Let's say, I think just a simple thing, I think we send out the list of questions that were asked after the webinar. I think we are able to capture those. Kayla and Cindy, if you could give me a thumbs up on being able to send out the questions, we'll certainly do them. Mechanisms for communication. As we did with the strategic plan, for example, we'll move ahead and set up a structure to report, to post reports, to keep all informed of what is going on. Let me see, so here's a good question, and I'm going to not respond, but promise to respond. Are there specific faculty within the School of Public Health whose work we can look to educate ourselves about that are exemplary in the areas of health equity and social determinants of health? So the answer is yes, there are many who work on these issues. What I'd like to do, and again, the kind of thing that we can post is do a survey of the kind of work that is going on that speaks to this issue. And again, I see this as part of the assessment, and that's both what is the reach of our work, whether it's practice or whether it is research that addresses racism, health equity, and the social determinants of health. I think, and again, in terms of one of the comments here, an important reminder that there'll be many of us in many units working on the issues covered by the plan, and we'll find a way to be coordinated. I know that the Department of Epidemiology, for example, has held several meetings to discuss structural racism. Community Behavioral Health has a meeting upcoming next week. I've heard that some units are having discussions, and we'll find a way to make sure that we all know what is going on. And I think another comment that I've covered, in what ways will concepts related to power, privilege, and oppression be integrated into multiple courses across the MPH curriculum? So I see this as flowing directly from the curriculum mapping that we will do. I mean, we're talking about issues that cross-cut, that extend everywhere. They reach into biostatistics, for example. What does blind adjustment with an indicator variable for race or ethnicity really mean? And what is behind what is captured in that variable? So, I mean, I think there's important learning everywhere across all courses, and I think we will do this. So, an important question about timelines. The couple of timelines are set. The most immediate is the identification and recruitment of the associate dean, and I see us as setting a timetable for the immediate things. And I think when we looked at the strategic plan, in spite of the impact of COVID-19, we saw many things in area 4 of the plan and elsewhere that we can do immediately. I will say I think we're all suffering from a bandwidth problem at the moment. I don't want to use that as an excuse for the time course for anything, and I think timelines will be necessary because we have certain markers that are upcoming. The start of the school year, accreditation that's not for a while, but the steps leading up to it are looming, and another important opportunity to do some of the work outlined in the plan. There's a question here on collaborations, the School of Medicine, Children's, the hospitals, to impact healthcare providers, clinical researchers, and the patients, families, communities they serve. I think that's something that we can perhaps learn from this new cross-campus committee that will be established, and I think we'll have an opportunity to be to be coordinated. I'm of course aware of some of the things going on our campus, but not all. Let me see. Okay, questions about looking at the recruiting process and wording. A good thing to do. We have some binds there that we have to live with, but an important issue. Let me just keep scanning through. Yeah, so I'll just say that is the department working with public schools in Colorado to provide guidance on school reopening? They need all the help and expertise they can get. I think the answer is, to my knowledge, and again, this speaks to the issues, the clear disparities in how well the tools are available to do online education. Clearly, there's a problem of both access to the internet, to broadband, to computers, and this is a key issue. Perhaps there's a place for us to be involved. I spoke at the Chamber of Commerce on Monday on our epidemic modeling and its implications for school reopening, and the superintendents for both Denver and Aurora Public Schools joined me, and they are certainly scrambling to think about how to get the schools open. I mean, things that I had just never thought about. How many children can you put on a school bus if you're socially distancing them? The answer turns out to be 24 on a 77-child bus. So the superintendents are grappling, and I think this is a good example where maybe we can partner with Aurora Public Schools and say, how can we help around the inequities in ability to access online education. So I think an important issue. Let me see, just still scanning through. Let's see, and then here's a comment about hiring practices and needing an overhaul, and a suggestion that we turn to a specific person whose work I've read about, Stephanie Johnson at CU Boulder. I think, as a general point, I think expertise that we can turn to that will be helpful. Yes, of course, we want to do that. Maybe a tough last issue, and I'll read it so you can hear the words. How are we addressing whiteness and white supremacy culture? It is so deeply embedded in academia and therefore shows up in the way we engage in public health work. How are we shining light on this, both for students and faculty, staff? So, I think the question, I think directly raised is one that just has to be with us as we move forward. I mean, we know who we are as a community in terms of the majority of the faculty being white, as our students, more diversity among our staff. I think in the end, this is one of the overlying challenges that we have to keep firmly in mind. And things that are deeply embedded, we get out of the habit of noticing. And I think what we've learned is that there are too many things we have not noticed. And that's within our school, but that is certainly more, way more broadly. So I think this is a moment where we keep the issue of trying to be more diverse in all ways as a goal. And I mean certainly um, academia has never reflected the diversity of our country as a whole, and in public health, you're right. I mean, put it directly, much of the research that addresses social determinants is done by white people, some of it about problems of white populations, but much of it about populations of color or with other ways that place them in inequitable positions. And I think, speaking to what's happened in recent years, these deep structural inequities in our society have been definitely worsened. So let me just scan and see, let's see, Kayla and Cindy, if you can send me a chat if there's anything broadly I've missed. We can send out the questions and answers. We'll do so. Following the recording will be posted. We have a lot to do. Your questions and comments have, I think, given us all, particularly me, a lot to think about. We will have timetables. We will move forward, and I hope by the time we move to the state of the school in later fall, that we'll have a lot to talk about and discuss. So thanks to all of you for joining, for thinking, for caring, and we'll talk soon. Thank you. Bye.